I think I'm ready.
Okay.
Okay. 1, 2, 3, go. Checking for scene safety, making sure it is safe for me to enter the room. I will provide privacy by closing the doors and the windows, making sure they are not locked for emergency purposes, drawing the curtains for privacy purposes. And since my hands are visibly clean, I will perform hand hygiene using this hand sanitizer. Dry, intact, no precipitates. Expire on January 2024. Pumping ample amount into my hand, do palm to palm. Palm at the back of my hands. Palms with fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb. Rotational rubbing of the fingertips against palm. Rotational rubbing of the wrist. I'll allow my hands to dry for 30 seconds, and now I'm happy to approach the patient. Hi, my name is Benz and I am your nurse for today. I am here to observe you and also ask you some questions related to creating a care plan for you. Would that be alright?
Yes.
Thank you. And before I start, I would like to confirm that I am with the right patient. Can you please let me know your full name and date of birth as I counter check it with my documents as well as your ID band?
Joe Smith, 16/12/1942.
Thank you. I got Joe Smith, 16/12/1942, and the hospital number is 123456. Perfect. I'm happy to confirm that I am with the right patient. And how do you feel right now? Do you have any pain?
Yeah, I do. I headache.
I'm so sorry to hear that, but can you please let me know if from 0 to 10, 0 as no pain and 10 as the highest, how do you rate your pain?
It's 8 out of 10 right
Oh,
now.
I'm so sorry, but may I also just ask if it radiates to some parts of your head?
It at the back of my head.
Okay, I will
my
take
head.
note of that. And also, later on, I will be checking your prescription chart if there are any available pain medications for you, okay?
Thank you.
And may I also know if, how would you like me to address you?
Just call me Joey.
Okay, sure, Joey. And may I also ask if you have any allergies to food, medication, or latex?
Yes, I do.
So what are you allergic to?
I'm allergic to penicillin.
And what happens to you when you take them?
It's making me hard to breathe.
I am really sorry to hear that. And I can see here that you're also wearing a red band. And as I check here in my documents, your allergy is already documented. I am happy to let you know that while you're staying here, you will not be receiving any medications containing penicillin. All right?
Thank you.
Thank you. And I would also like to ask you, because I've seen here that you got you have cigarettes on your table. Are these yours?
Yes.
And I'm so sorry, but I'd like to inform you that this hospital has lots of oxygen around, and it will be combustible if it has cigarettes also around. So what I can do is either I can keep them in a safe cupboard, it's locked, or I can ask your relatives to bring it with them and just give it to you whenever you will be discharged. So what would you like?
Just give it to my relatives. Please.
Okay, I will do that. And also, I see here that you have hearing aids. Are these yours?
Yes.
Do you hear me clearly?
Yes, I do. It's
Sure,
on
just
me.
let me know if you want to use them, okay? How about this walking stick? So, you have problems with walking?
I do. In fact, my left leg is a bit wobbly.
Oh, I'm sorry, but don't you worry. I'll definitely refer you to our occupational therapist so that you will be able to be assisted with your mobilization, okay?
Yes, please.
Thank you. And all right, Joe, so what I mentioned, I will be having sets of observations here. So before I start, I'd like to assure you of 5 things. So that will be, first is that every body part that I will be touching are free from any infection, inflammation, discharges, no recent surgeries, safe for me to use. And also every time that I will be using an equipment for you, they are free from any they were already calibrated and checked for the past 24 hours. And also every time I'm gonna touch you, I will perform hand hygiene, and I will always be asking for your permission whenever I'm gonna touch you. And I'd like to make sure that you're comfortable right now. You've been rested for the past 30 minutes, your legs are uncrossed, and also before I start, I'd like to know that your bladder has already been emptied, right?
Yes.
Okay, so which arm do you prefer?
I prefer the left
Okay,
arm.
so on your preferred arm, I will put a BP cuff in appropriate to your size, and I will put it 2 to 3 centimeters above your antecubital fossa in line with your brachial artery. I will pop a pillow underneath so that it will be in line with your heart, and also you will feel a tight squeeze, but that should be normal. On your other hand, I will be checking for your capillary refill. So I'll check for your nail beds for any presence of nail varnish, nail polish. And I will be pressing your nail bed for 5 seconds, and it should come back, or the blood should come back for less than 2 seconds. And also, I will now be using the SATS probe. And I will be asking for 2 minutes of your uninterrupted time. For the first full minute, I will be checking for your rate, quality, and rhythm. And also, for the next full minute, as extra, I'll not tell the patient that I will be observing the respiration for the rate, quality, and use of accessory muscles for us not to alter the results, but I will tell them later on. So after that, I will also be checking for your tympanic temperature using this tympanic thermometer. And this tympanic thermometer, I will check for your ear. I will pull it back and up and back, and I will insert the probe, and this disposable probe, you will hear a beeping sound, but that should be normal. I will do it on the other side, record which one is higher, and I will take note of that. And so upon entering the room, I have already checked for your eye opening. And for verbal response, I would just like to ask if you know what's the date today and the time.
It's I think it's the 15th of July.
Oh, I'm so sorry to hear that. But today, Joey, today is 22nd of June, 2021. Okay? So you know where you are right now?
In the mall?
No, you are in the Southampton General Hospital, okay? And also, what's the time to say?
I think it's 3 p.m. now.
No, it is 8 a.m. Joey, okay?
Okay.
Don't you worry, I'm here to always reorient you, okay? And also, for your motor response, I will be asking you to stick out your tongue and also to raise your eyebrows. And for your upper limb power, I will be asking you to, for your upper limb, I will be asking you to raise your, extend your arms, facing upwards, and also close your eyes and do that for around 20 to 30 seconds. We will be checking for any possible drips. And I will be asking you to squeeze my hand afterwards, and squeeze my hands, and I will pull as a resist and push as a resist. And for your lower limb, I will be asking you to lie flat on bed, and also I will ask you to lie down on bed, and your knees should be flexed, and also your knees should be flexed, and then I will put my hand over your thigh and push up as I resist. I will put it under your thigh and push down as I resist. And after that, I am happy to record my observation. So, assessor, can I now record?
Yes.
Thank you. Pero ballpen, sorry. Alright, and Joe, I have already documented in here the results of our neurological observations, and I see here that you were on your eyes were only responding to sounds, and also I see that you have been oriented, also lang. And also you obey for my commands, and also I see here that, oh, I'm sorry, I need, assessor, I'll just need to make sure that my documentation is complete. I have not yet documented for the temperature of the patient. Okay. Joe, I see here that your temperature is normal. It's 37.0. I got your blood pressure, which is 171 over 102. That's a bit higher because you've been having headache. So we will address that, I assure you. And also your respiratory is still normal. It's 15. You got reactive pupils. And I see here that you got normal power for your upper limbs and also for your lower legs. your leg has is normal, but your right leg seems to be weak, mildly. But don't you worry. I'm happy to um I'm happy to relay or to refer you to our occupational therapist to help you with your mobility. And also, for your total score, it is actually 14. So what I can do is I will make sure that I will observe you for every hour, and also make sure that if ever your clinical condition changes, I will still be checking on you. And I will relay these results to my nursing charge and also to your physician, okay? And also, for your oxygen saturation, it is also normal. Do you have any concerns right now?
Yeah, I do. I left my cat at home as well as my wife.
Oh, I'm so sorry, but I assure you that I will coordinate with our social services for your wife and also to the pet welfare for your cat. Okay?
Thank you very much.
No problem. And also, I would like to also let you know that I appreciate your cooperation for this procedure for your observations. I highly appreciate your time and effort answering my questions. And also, assessor, I will make sure that everything, every equipment that I have used have been cleaned and disinfected, ready for the use of the next patient. And also, I will throw everything in the clinical waste bin, and I will make sure that I will perform final hand hygiene.
Nakakahingal, no?
Hingal ako, Dash!
Ako din eh.
Parang sabi ko, ang hirap pala kapag may mga side drafts, ang dami mo kailangan sabihin.
Nasusubukit ako sa mask. Kainis.